And your Health Watch today for those living with epilepsy, it can be all-consuming. Almost 3 million American adults have epilepsy, according to the CDC, and global numbers from the World Health Organization say nearly 80% of people who they live with the disease live in low and middle income countries, suffer from stigma and discrimination from it. Joining us now to talk more about this is Dr. Lindsey Fish from Denver Health. Dr. Fish, thank you for being with us.
My pleasure.
We always look forward to having you on Thursdays. So let's talk a little bit about what is epilepsy and what should we know if we're not very familiar with it.
So epilepsy is a neurologic disorder where you have abnormal brain activity that can cause movements, sensations, behavior, and consciousness that are different from normal and not under control by the person. As you mentioned, it's extremely common. Here in Colorado, we've got 60,000 people living with epilepsy. That's 1 in 26 people. And in fact, 1 in 10 will experience a seizure over the course of their lifetime. As you mentioned, many people with epilepsy are going to experience, challenges and stigma because of their disease, because we don't understand it very well and people don't talk about it. And so that's what this month is about, as we're trying to raise awareness on epilepsy, is everybody to raise their awareness, their understanding, and how they can help people with epilepsy and support them.
We know that people with epilepsy have seizures. If someone witnesses someone having a seizure, what do you do? How do you help out?
Yeah, so the first thing is to remember the 3 S's. So you want to stay with the patient and make sure that you stay calm during that time. You want to ensure that the scene is safe so that the patient doesn't hit something hard or severe, and that you want to protect their head and cushion it if possible. And then lastly, you want to roll the patient gently onto their side in an effort to minimize the risk of their airway. So those are really the 3 most important things during a seizure. If you're not sure what's going on, obviously call 911. And don't put anything in their mouth or try and restrain them.
Okay, great information. Denver Health's Brooke Gordon's Comprehensive Epilepsy Center is designated as a level 4 epilepsy center. This is fantastic. That's the highest ranking by the National Association of Epilepsy Centers. So tell us a little bit about the services that are right here within our city.
Yeah, so we are really proud of our epilepsy center at Denver Health because we really are able to provide comprehensive care, not only from medical and various types of doctors that can help you in this, but really the other support needed. Support groups, mental health support, women's health support, genetic testing, some of these other things that are really important for people who have epilepsy. Additionally, we can offer minimally invasive surgeries and brain devices that, if medications aren't working for you, are the next step to help you ensure that you can live a full life.
Is the medical treatment getting better for those with epilepsy?
It really is. Our medications actually can allow 70% of people to have minimal seizures. So really effective medications. There are still 30% that struggle with that, but that is why we now have these new forms of treatment that go right at the brain where the problem is.
Fantastic. Dr. Fish, as always, thank you so much for being with us. We appreciate you.
Thank you.